Assalamualaikum and hi, my name is Nur Fakirah Hanis binti Azmi and my matric number is 077680. And our group gonna present about peptide. So I'm gonna explain introduction, class of peptide. Okay, antibiotic peptide, also known as antimicrobial peptide, are small molecular peptide typically composed of 12 to 50 amino acid residue. Widely distributed in nature. AMPs are derived from diverse sources including bacteria, plants, insects, fish, bird, animal, and even humans. They are essential effectors of the innate immune system, serving as the first line of defense against pathogen infection. These antibiotics are highly effective against bacterial infection, particularly those caused by gram-positive bacteria, due to their ability to directly target bacterial membranes and disrupt vital processes. Most peptide antibiotics carry a positive charge because they contain amino acid like lysine or arginine. This charge allows them to interact with the negatively charged bacteria membranes, such as phospholipids and lipopolysaccharida. This interaction helps the antibiotic stick to the surface of bacterial cell, which is a key step in killing the bacteria.
We will move on to pharmacokinetics of peptide. So the first step is absorption. Peptides have poor oral bioavailability because they are easily broken down by enzymes in the digestive tract and have low permeability. Therefore, they are easily administered via intravascular, subcutaneous, or intramuscular routes. Through nasal delivery is also an option. And the second step is distribution. Peptides mostly distribute within extracellular fluids driven by diffusion and to a lesser extent connective movement. Their distribution is limited by their size and hydrophilic nature, resulting in small volumes of distribution. And the third step is metabolism. Peptides are quickly broken down by enzymes found throughout the body, leading to short plasma half-life. To improve stability, strategies like amino acid substitution, terminal modification, and linked peptides to larger molecules are used. And the fourth step is excretion. Peptides are primarily eliminated by the kidneys through glomerular filtration, followed by further breakdown in the renal system. Next, we'll be moving on to pharmacodynamics of peptide. So for the first one is concentration-dependent killing, which is peptide kills bacteria faster at higher concentration and effective against drug-resistant bacteria. And the second one is minimum inhibitory concentration, MIC. MIC shows how much peptide is needed to stop bacteria growth. Lower MIC is equal to more effective at lower doses. And the third one is inoculum effect. More bacteria is equals to slower killing by peptides. And the fourth one is regrowth of resistant bacteria. Resistant bacteria may grow back if the peptide does not reach high enough concentration. Peptide may need to be combined with other treatments. And last but not least, post-antibiotic effect, PAE. Peptide can suppress bacteria even after the treatment stops. The effect usually lasts for a short time.
There are two examples of drugs that can be used. The first one is bacitracin. The classes for bacitracin is bacitracin belongs to the peptide antibiotic class, known for its bactericidal action against gram-positive bacteria. Primarily used as a topical agent, bacitracin is favored due to its poor absorption through the gastrointestinal tract and the potential nephrotoxicity associated with systematic use. As a result, it is commonly applied in the form of ointment to treat minor skin infection while minimizing the risk of systematic side effects. The dosage for bacitracin is applied only enough to cover the affected area 1 to 3 times a day, but apply a thin layer of the ointment. The duration of treatment usually lasts for 7 days. Okay, for the next drug is polymyxin. The classes for polymyxin are a class of peptide antibiotics that are particularly effective against gram-negative bacteria. They include polymyxin B and polymyxin E, also known as colistin, both of which are used to treat severe bacterial infection caused by multi-drug resistant organisms. These antibiotics work by disrupting the bacterial cell membrane, leading to leakage of cellular contents and bacterial death. For dosage of polymyxin, the first one we have IV polymyxin B or polymyxin E, used for severe infection, example as multi-drug resistant gram-negative bacteria. Polymyxin B for adult, we use 50,000 to 25,000 units per kg per day. It is divided into 2 doses. For polymyxin E, for adult we use 2.5 to 5 mg per kg per day divided into 2 doses also. Okay, next for minor skin infection, dose that can be used is apply a thin layer to the affected area 1 to 3 times daily as directed by a doctor. The last one, we can use eye drops or ear drops for polymyxin B, which is used for infection like conjunctivitis or otitis externa.
So I will present about the therapeutic effect of peptide. First, we go for bacitracin. Bacitracin is used to help prevent minor skin injuries such as cuts, scrapes, and burn from becoming infected. Bacitracin also works by stopping the growth of bacteria. It is effective against gram-positive bacteria. Second is polymyxin. Polymyxin, specifically polymyxin B and colistin, are broad-spectrum peptide antibiotics that are primarily used to treat gram-negative bacterial infection, particularly those caused by multi-drug-resistant organisms. These drugs are considered last-line antibiotics due to their efficacy against difficult-to-treat infection. It is topical formulation for skin and eye infection. Next, we proceed with the side effect of peptide. For bacitracin, the possible side effect may be nephrotoxic reactions such as kidney toxicity, nausea and vomiting, itching, skin rashes, sweating, and injection site reactions such as pain, burning, and swelling. Meanwhile, for polymyxin is redness, pain, swelling, and temporary eye itchiness. Also, temporary blood vision is used as eye drop. We continue with the adverse effect for peptide. Firstly, for bacitracin, nephrotoxicity because it can be toxic to the kidney if absorbed systemically. An allergic reaction that is rare but may include rashes or itching. Second is polymyxin. Nephrotoxicity, polymyxin can cause renal damage, which is dose dependent. Careful monitoring of kidney function is essential during therapy. Next is neurotoxicity. It can lead to peripheral neuropathy and respiratory failure, particularly with high doses. And lastly, allergic reaction that is rare but may also include rash or fever. Other than that, for the contraindication, bacitracin, it is contraindicated for systemic use because of its nephrotoxicity. Bacitracin can cause kidney damage when absorbed systemically, so it is almost exclusively used topically for skin or mucosal infection. Second is hypersensitivity reaction. Patients with a known allergy to bacitracin or its component should avoid use. This could manifest as skin rash, itching, or more severe reaction. Next, for the polymyxin, first is renal impairment, contraindicated in patients with pre-existing renal dysfunction or acute kidney injury as nephrotoxicity. The second is neurological disorder because it can cause neurotoxicity. The third is allergy, and the fourth is use with caution in pregnancy.
Now, I will be discussing about nursing care of administration of the drug, which are the 11 rights of medication administration. These are essential practice that healthcare professionals must follow to ensure patient safety, avoid medication error, and improve outcome. First 11 right is ask patient to state their full name aloud and match it with their charge. Tell wristband to confirm their name and ID number if applicable. Avoid using only first or last names, especially in units with patient having similar name. For patients without wristbands, example psychiatric patient or with altered mental status, use alternative method like family members or other documentation to confirm identity. Always double check and follow protocol to ensure patient safety. Second are right drug. We need to verify the medication name, match their prescription exactly, as some drugs have similar name but very different use. Check the packaging for the important details like expiration date and any potential issue with labeling. Avoid confusion by focusing on full generic names rather than brand names which may look or sound similar. Next are right route. Okay, for our topic, we got bacitracin and polymyxin. For bacitracin, we need to use topical route, which are applied only to intact skin unless directed otherwise. And then for polymyxin, we need to use intravenous. Next are right time. Medication should be given as close as possible to the prescribed time. Nurse should not deviate from the prescribed schedule by more than 30 minutes to ensure the drug's effectiveness. Next are right dose. We need to prevent medication dosage error, which are first common error is incorrect dose, wrong composition of unit, or wrong concentration of the medication. Mistake can happen with misplaced decimals or confusing units like micrograms or milligrams. Second, how to prevent errors are by consult pharmacist personnel if unsure, use calculator for accurate arithmetic, and double check with patient or their families about their usual dose. Next are right assessment. We need to perform an appropriate clinical assessment before medical administration, like check blood pressure before antihypertensives or blood sugar before insulin. Next, right documentation. We have to record all relevant details immediately after administering medication, including drug name, dose, time, and any observation. Documentation is vital for legal, ethical, and clinical accountability. Next are right evaluation. We have to always monitor the patient's response to the medication, assessing for therapeutic effects and adverse reaction. We also need to write a report and document any unexpected outcomes promptly. Next is right education. We have to educate the patient on why they are taking the medication, how it works, and potential side effects that might be occur. We have to provide clear instruction on how to use the medication, especially for those prescribed self-administered drugs. Next are right to refuse. We have to respect if patient refuse the drug we're going to administer. We need to explore and address the reason for refusal while educating them on importance of treatment. And the last one is right expiry date. Always check the expiry date of the medication before administering. Dispose of expired medication according to healthcare facility protocol to avoid compromising patient safety. That's all for me.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Farzana binti Muhammad Sukri and my metric number is 077638. So next I will teach about health teaching for the patient. So bacitracin and polymyxin as antibiotic peptide are primarily used to treat infection, and while they are effective in killing bacteria, this antibiotic typically for external use on the skin or mucous membranes and should not be ingested. Always apply a thin layer to the affected area and avoid using large amount or apply it to the broken skin ointment unless advised by a doctor. So be aware of potential side effects such as irritation, rash or unusual sensation like burning, and wash your hand before and after applying the medication to prevent contamination. Next is side effects. So when using bacitracin and polymyxin, we must be aware the potential of side effect. So for the bacitracin, which is usually applied topically, it can cause skin irritation, redness or an allergic reaction such as itching or swelling at the application site. Next, for the polymyxins, such as polymyxin B, may lead to more serious side effect, particularly if used systemically, including kidney damage, difficulty breathing, or dizziness. Rarely, polymyxin can cause nerve damage, leading to numbness or weakness in the muscle. The last one is diet. So while using bacitracin and polymyxin, they are not specific dietary restriction, but maintaining a balanced nutrition diet can support overall health and help body recover from infection. So if you are using polymyxin B intravenously, staying well hydrated is important, as this medication can affect kidney function. Drinking plenty of fluid and consuming a balanced diet rich in fruit, vegetable, whole grains, and lean protein will help strengthen your immune system. If you experience any side effect like nausea or loss of appetite, try eating smaller. It can help manage this symptom. That's all from us. Thank you for watching.